Hey y'all, and welcome back to my channel. On this page, I talk about technology and money. If you're new here, very welcome. I'm glad the algorithm brought you here or someone shared the content with you. I'm glad you're here. Please consider subscribing to the channel so you will get notified each time I update a video. And there's also a notification bell on my page. So clicking the notification bell, what that does is that notifies you when I go live or anytime that there's new content. And if you're a returning subscriber, welcome back. And I just hope everyone's having a good day so far. So today I'm coming to you all with some interesting news that I came across regarding the use of robotics, artificial intelligence, to help with the nursing shortage, and then also digital upskilling for nurses. Like on this channel, and also in a collaboration video I did with Black Women Making Money on her channel, we talked about the future of work for all women. Actually, we talked about the future of work for all people. I specifically spoke to the future of work for nurses. I've talked about that before on this channel as well. And also robotics and AI that's used in healthcare. But today I'm going to share with you all the first time that I have seen robotics and artificial intelligence specifically targeted to the nursing shortage. Like I've seen where increasingly hospitals, health systems in different areas are using robotics. Hospitals have been using in healthcare have been using robotics for years. When I started nursing almost 25 years ago, we were using robots back then to carry medications back and forth to the pharmacy. Surgeons use robotics to perform surgeries to help assist to be more precise in their work. We've seen hospitals using robots for different things, different nursing tasks. But this is the first time I've seen where it's specifically being tested to help address the nursing shortage. And then we're going to talk about digital upskilling for nurses as well. Okay. So I'm going to share my screen here. And as always, I will be sure to leave a link to all articles and the references so you all can go and research and read more for yourself. Again, like I tell you all, please do not believe everything I say. And that's just with anything I talk about with technology and money on my channel, but just with anything you come across on the internet, always be sure to do your own due diligence, okay? And also, please like and share this video. Liking and sharing the video helps the algorithm send this type of content to more people. So you add value and it helps people find the channel. And then it encourages me to continue creating content that you all find interesting and useful. So our first article or first news today, this is fresh, comes to us from Philips about the 10 healthcare technology trends for 2023. Now I'm going to do a caveat here because this Philips is, if you're not familiar, Philips is a vendor that does healthcare like software and products and things like that. And it's just a caveat and something for you to be aware of. Anytime you read an article or a white paper, sometimes a white paper article, anything from like a vendor who has like a product to sell, just always keep in the back of your mind that, they do maybe trying to influence your decision making. Okay. So just keep that in mind as well, because sometimes these articles and things and white papers and things they release can kind of be, influence. It can be like marketing material. Okay. I just wanted to share that. I don't have anything to sell to you or have a conflict of interest, but I just wanted you to be as a consumer, whether you're a nurse, or a patient, a consumer, just to be mindful when you come across articles from vendors and things like that, from healthcare technology companies and things. So on their 10 healthcare technology trends for 2023, two things they talk about here that I want to hone in on. And so we're just going to focus on the first 2 points. So they say Workforce shortages, mounting workloads, and economic pressures are challenging healthcare providers worldwide to improve operational efficiencies and innovate care delivery models. We know that, right? That's very well known. And then they say socially conscious healthcare leaders also recognize their responsibility to improve healthcare equality. I would take it a step further and say equity, as well as the need to reduce the sector's carbon footprint for the preservation of the planet's health. So to address these challenges, and here are 10 trends they predict to gain more traction in 2023. The first is addressing workforce shortages with workflow automation and AI. So staffing, of course, is a concern, no matter if you work in a hospital, you work in a health system, a clinic, ambulatory surgery center, home health care, hospice, etc. Staffing is definitely a big concern. And staffing and labor can also sometimes be one of the largest budgetary items for an organization. So they talk about burnout and staffing shortages could continue to weaken healthcare systems, like, if nothing is done. They talk a little bit about radiology, but I'm going to focus on the nursing piece. So they say in nursing, it can be expected an estimated global shortfall of 13 million nurses by 2030. And that is really interesting. If you all been on my channel for a while, not last year, in December of 2021, the North Carolina Board of Nursing collaborated with UNC Chapel Hill and some statisticians to create a nursing workforce tool that recruiters, hospitals, etc., nursing schools can use to help estimate how many nurses they would need in a particular area of the state, a particular area, a specialty like nursing or a clinic, etc. So hospitals and health systems and nursing schools, etc., could work now on the anticipated demand for like nurses, LPNs, etc., for their part of the state. So compounding the stress and strain, healthcare professionals now face a backlog of routine treatments set aside during the pandemic. Given these workforce challenges, we will see healthcare providers leverage automation enabled by artificial intelligence to increase efficiencies and augment the capabilities of staff. So they talk more about radiology. Again, I'm not going to focus too much on radiology because I'm a nurse, but it is a very important specialty. So they talk about automation is a healthcare technology trend that could also be used to reduce the burden of repetitive administrative tasks for physicians, nurses, and technology, so they spend less time in front of computer screens and more time with patients. And then they talk about how automation can help with workflow improvements, like patient monitoring, etc. So that's number one. And then number two is digital upskilling. And that is digital upskilling through continuous training and education. So before I get into the digital upskilling and for nurses, how we can use this concept of digital upskilling no matter where we are in our nursing career or nursing journey or the area that we work in, how we as nurses can prepare ourselves for the continued pervasiveness of technology in healthcare. I want to, because again, I said that article from Philips is very vendor-based, and to me it's part marketing, and I acknowledge that. But I'm going to share this other article from this NBC News outlet about how this hospital is using robots. They're testing robots to assist with the nursing shortage. Let me do a quick time check. Okay, cool. We're 9 minutes in. So what you see here is the Moxi robot. Now, I've talked a bit about Moxi before on this channel, and I've seen Moxi in person. I went to a large nursing conference last fall, and I hit the vendor floor. Moxi was there. I checked the robot out. It has like little pockets, not pockets, like compartments where you can put stuff in and secure it. I thought it looked to be a little bit clunky and heavy, but I have a feeling that is by design, so it doesn't tip easily or is moved easily, etc. So the article says health headlines: robots being tested to assist with nursing shortage. So this is out of Jacksonville, Florida. And it says the world is dealing with a nursing crisis. Currently, 2 out of 3 nurses in the United States say they are considering leaving the profession. This comes as the Bureau of Labor Statistics reports we will need 200,000 more nurses in the next 10 years. So burnout, retirement, growing aging population, there may not be enough nurses to handle the rising demand. Let me just pause here and say a moment. I've been a nurse for almost 25 years. There's always been a quote nursing shortage, unquote, right? Even back then when I was a nurse fresh out of nursing school, they were talking about a nursing shortage. So it's just the demand has always outweighed, at least for my length of my career, the demand has outweighed the supply. So one answer the article said may be robots, not to replace registered nurses, but to help them in tasks that take their time away from patients. One of them is Moxi, a robot that may fast become a nurse's best friend. From retrieving supplies, delivering food, and running for meds, Moxi is paving the way for robots in healthcare. So this chief digital officer at this hospital says we just can't churn out more nurses, and the demand is off the charts right now. So how do you enable them to work smarter and not harder? Okay. So this robot uses artificial intelligence and machine learning. And if you all don't know, in a very basic sense, machine learning is just what the word says. As you feed the algorithm more data, it gets smarter, faster, and better. Very similar to the YouTube algorithm, right? The more videos you like and share, the algorithm learns what you like and it delivers more of the same content or even similar content that's not exactly the same, but somehow related. It brings more of that to you. So the robot uses AI machine learning to roam halls and navigate people, equipped with 3 locked drawers and an automated arm. Then it says that it can, go to the pharmacy, dietary to get food and supplements, medications for their clinical team. So recent studies show that nurses spend at least an hour a shift tracking down equipment. Now we was doing that back then, Lord. You would just be running all over the floor looking for linen, the vital sign, the Dynamap, all of that. And that's this hospital that's testing it out for the nursing shortage. Just saying that's things like tasks like that, where you're running around the unit looking for the bladder scanner, looking for if your hospital doesn't have vital signs, automated vital signs integration, and you have to look for a Dynamap, looking for the blood sugar machine or the glucose monitor, just things like that. The robot can help. There are other things that can help, but the robot is one of those. And so they have a DMP that is helping test this out. She said, when we walked just yesterday on the path that the robot will go from the pharmacy, it took about 15 minutes. So when you multiply that by multiple times a day and then multiple times a week, that's more time spent with the patient, more time doing what we need to do, not only for the patient, but our family members as well. And so it goes on to say that the robot is in 100 hospitals through the country, but there is concern robots may replace humans. A survey of nurses who work with delivery robots found that roughly half worried that robots represent a threat to their jobs. I don't have concerns. I just want to make sure. I don't think a robot can ever replace a human nurse at the bedside. Just with the emotional intelligence and the soft skills that a human can do, that there may be robots out there that can, but I just don't know. But yeah, I don't have concerns just yet. But again, I have to learn. There's more for me to learn about, how they work and things like that. And so then this company goes on to say, the robot can't really replace the human touch. I believe that, at least from what I know. Right now, robots in healthcare are only utilized for repetitive, time-consuming tasks without patient interaction. And experts believe robots roaming the halls may be one of the solutions to a growing healthcare crisis. So someone compares, Tesla and autonomous cars to autonomous robots in healthcare. I'm not sure if that's the same, a good analogy, considering some of the ways that Tesla have gone left, in the recent some issues with it. So at one hospital, within 6 weeks of initial implementation, the robot saved clinical teams nearly 300 miles of walking. That's a lot of time. That's a lot of time, y'all, and that's a lot of energy. So I can definitely see where the benefits could help. Now, back to this digital upskilling here for nurses, and then we're going to wrap up. So, okay, and I have a link here from Becker's as well that just talks about these 10 trends. It's the same that I shared a few minutes ago. So let's go back here to the digital upskilling. So workflow automation can go a long way toward alleviating the burden on overstretched hospital departments. But healthcare professionals also need appropriate training and education to keep up with technological advances. With 1 in 5 healthcare professionals having left the field since the pandemic began, adequately training new staff is especially critical to ensure continuity, safety, and quality of care delivery. So the years ahead, we see a growing demand for education as a service, supporting ongoing education and continuous learning as the pace of digital transformation in healthcare further accelerates. In addition, hospitals can drive proficient use of new and existing technologies by appointing super users who act as early adopters and ambassadors, etc. I think anyone who's ever worked at a hospital or been a part of any implementation understands what a super user is. If you don't know what a super user is an early adopter. Say if your hospital is implementing, let's take it off of like software. Say if your hospital is implementing a new type of bladder scanner or a new type of IV product, right? A new type of IV product or a bladder scanner. A super user would be someone who is first taught and trained on that product, who then becomes like the on the unit or on the floor expert to then help their coworkers. And then once the implementation team has left the hospital or the unit, the super user, the person who learned first, is the one who becomes the go-to and the subject matter expert in that area. Let's see, was there anything else here? Okay, so in 2023, we will continue to see a rise of blended learning models, combining the best of in-person training with self-directed online learning, self-paced tutorials, e-learning, webinars, and gamification to more advanced methods such as augmented reality and virtual reality. So what does this mean for nurses in terms of digital upskilling? So I did a video on my channel at some point last year. I'll try to link it below on, I think it was like 3 ways to become more technically proficient or something for nurses. I got to find it and I'll be sure to link it. So 3 things that nurses can do to digitally upskill, no matter what specialty you're in or where you work. Number 1, you can become a super user. And the article talks about that. And I just talked about that about 2 minutes ago. Number 2, a way you can upskill yourself digitally is participate actively in professional organizations. Now, why is that important? Because again, within professional organizations, that allows you to network. You learn about the new technologies that are coming. You learn about what other hospitals, organizations are doing. You learn about the newest of the new. You're not just relying on YouTube videos or the news, or because we can't we can't find everything we know on the internet all the time. Sometimes that human element and being connected to other people and other organizations doing different things is a way that we can learn about new things, new technologies as nurses. And number 3 is submitting abstracts to present at professional conferences and or helping with pilots of new software. It's similar to a super user, but a little bit more than a step beyond that is being part of the design team, the implementation team, as your organization is designing new policies, testing out the new software, the new technologies, you actually being a part of that and assisting with any data collection that's being done, any data analysis, and you can do that even at the bedside. You don't have to be an informatics nurse to do that type of work, but doing that type of work at the bedside will help you become more efficient in that type of work and that type of critical thinking. And if y'all want me to do a video on tips on submitting abstracts for professional conferences or writing abstracts, I'll be happy to do so. Leave a comment or send me a message. That's it, y'all. That's all I have for today. I hope you found this information useful. I'll be sure to leave a reference to every article that I share in this video, as well as my contact information. Please do like and share this video if you made it this far, and I will see you in the next video.